Just a reminder to everyone, recently, there have been a lot of patients seeking medical attention due to the flu. Last night, I did nothing but handle patients with fever. The flu virus is widespread, and many doctors, nurses, and even patients' family members in our ward have contracted it. This flu is really severe, and 90% of it is H1N1. Many people have been asking how to avoid it. I tell them that it's really hard to avoid. Everyone take note, this year's flu wave is especially fierce. This H1N1 strain is really aggressive. Look, even my wife got infected. I just took her temperature and today is the third day. Does anyone else feel that this H1N1 flu is possibly more serious and troublesome than COVID?
As the Chinese New Year approaches, multiple viruses are spreading, and hospitals are overcrowded. There have been reports online of many people dying from the flu virus. At the same time, the Chinese government has changed its previous approach of avoiding the pandemic and suddenly issued a new epidemic prevention notice. Experts are questioning whether the COVID-19 situation in mainland China is once again out of control and accusing the government of continuously concealing data and deceiving the public. I didn't expect the situation to be so severe. I just watched a video showing that H1N1 flu is surging in many areas. And now, the situation is overwhelming in hospitals, especially as the situation is complicated with multiple viruses circulating, but all of them are contagious. Don't wait until it's too late and you end up in the hospital, because the number of deaths now exceeds even the death toll during the peak of the pandemic.
I am truly shocked by this H1N1 flu. It's just as bad as the COVID-19 from back in the day. This morning when I arrived at work, I heard some very disturbing news. A colleague whom I saw just before the new year passed away today, and he was only in his early 30s. The cause was H1N1 infection, which worsened due to his already weakened body after 2 years of the COVID-19 pandemic. His daughter contracted the flu, and it led to his hospitalization. In just 15 days, he was gone. Life is really fragile. Last night, I called my mom to remind her to take care of herself because H1N1 is particularly severe lately. I shared this news with her, and she told me that in our hometown, 2 people around 50 years old passed away this year. It felt so normal at first, but suddenly they're gone. Once you get infected with H1N1, it's not just a normal cold. You must be extra cautious, as it can easily develop into pneumonia, which can be fatal. The level of discomfort this time is far worse than when we faced COVID-19. If you can stay home, just stay in. Today marks the 6th day of my H1N1 infection, and it's almost taken my life. I can't eat, can't drink, feel nauseous, and my whole body hurts. In the past few days, I've seen several children who died from H1N1. As a father, every time I see these stories, it breaks my heart.
A netizen, from Shandong, commented on January 18th, "My son had acute myocarditis, and after 13 days of rescue attempts, we couldn't save him." A netizen, from Hunan also commented on January 18th, "My cousin also died from myocarditis, only 37 years old, leaving behind 3 children." Another Shandong netizen commented on January 17th, "A few days ago, a child in our area caught H1N1 flu, and it seems like he developed myocarditis and passed away. It was only 1 day from diagnosis to death, and the child's mother is a doctor." A Hainan netizen also commented on the same day, "A colleague of a family member, 46 years old, died from myocarditis after contracting H1N1 flu. His main symptom was calf pain." A Jiangsu netizen commented on January 14th, "I just saw a 15-year-old junior high student at the hospital. After running, he felt unwell and was sent to the hospital too late. We couldn't save him. He passed away the first day after exams." A mother from Chongqing commented on January 12th, "My son had H1N1 meningitis, vomiting, fever, and weakness. He was 3 months shy of 9 years old. He passed away so quickly, and I still can't believe he's gone." A female Jiangsu netizen commented a week ago, "Yesterday at noon, my nephew, 28 years old, died from myocarditis." A mother from Guizhou commented a week ago, My daughter passed away last month from myocarditis. It's so hard to prevent. A Jiangsu netizen also commented a week ago, a relative had a cold and fever for several days last month. He drove himself to the hospital and collapsed while waiting for the report in the lobby. He couldn't be saved. It was viral myocarditis.
I can't say for sure that it's happening across the whole country, but at least from the news I've seen, the flu, particularly the H1N1 flu, is spreading very severely in big cities like Beijing and Shanghai. You can check the exact numbers online. Since I used non-essential earlier, let me make another sentence. Non-essential outings should be avoided, and non-essential visits to the hospital should be avoided. Today is the 10th day of my H1N1 infection, and I want to remind everyone to take preventive measures. We must avoid getting this disease. It really brings a lot of suffering. My mom and my child were both infected, and when I searched for this medication online, I was shocked by the high prices. One box costs $240, and the second one costs $280. Each box only contains 2 pills, and an average adult needs to take 2 pills. The worst part is that I have a large family, so I need to buy 2 boxes, but I can't find them. What about people who are poor? Would they really spend so much money on these expensive medications? If they can't afford it, does that mean they have to endure the pain?
We always talk about overproduction, don't we? But why is it that when we need to buy medicine, it's out of stock? Why is it that when we are in urgent need, it's unavailable? The same thing happened with masks back then, and it's the same with fever medicine now. I really can't hold on much longer, it's one wave after another. Recently, our whole family has been infected, even the doctors have caught it. Everyone says it's especially miserable. Friends, this time the H1N1 flu is something to seriously watch out for, especially for the elderly and children in your household, those with weaker health. Make sure to protect them well. For those who are more socially active, it's best to avoid public places. This flu isn't like ordinary fever and cold. It's much worse. Let me tell you a shocking secret. Recently, the H1N1 flu is spreading like wildfire. Even old Wu in my house got infected with fever, headache, cough, and extreme fatigue. He's taken fever medicine and detox pills, but there's still no improvement. This year's H1N1 flu is really severe. At our hospital's respiratory department, I would say the entire respiratory system, the fever clinic is packed every day. With the Chinese New Year approaching, and with a large movement of people and high infection risks, the Chinese government's cover-up of the severity of the epidemic might lead to an even wider spread. In a video posted on January 16th, the Douyin, Chinese TikTok, influencer Wang Wenming revealed, everyone in our neighboring village, young and old, has collapsed. The elderly and children can't stop coughing. There's no end to the conversations about the situation. Adults are experiencing full body aches, dizziness, and a low fever that lasts for 3 days and nights. Even lying down, they're having hallucinations. In his comment section, a Shandong netizen commented on January 17th, in our village, 32 elderly people have passed away in the last month and a half. A Shaanxi netizen also commented on January 17th, this year, our village had 1 newborn and so far, 8 people have passed away, with 2 more hanging on by a thread. Another Shaanxi netizen left a comment on January 18th. Recently, people in our village have been saying that over a dozen have died from the flu. A Sichuan netizen commented on January 18th. This virus is indeed vicious. In my village, along a small road where stoves are sold, 4 or 5 families are mourning. Feels really bad. Yesterday, I saw many households affected. As for those who traveled out of town during the holidays, whether they're from Beijing, Wuhan, or Shanghai, people have been advising on social media, the flu is severe. Don't come around recently. A Beijing netizen said, at our office in Dongcheng, everyone in the office caught the flu within a week. It all started when a colleague's child got infected at school, and many people around me caught it too. Now everyone is resting. One netizen said, all of my colleagues are bedridden. Everyone caught the flu, I caught COVID, don't come. On the first day, 3 people were already infected. Now I just want to go home. The flu is absolutely crazy. Today I caught it too. Here's what happened. I took my child out to eat, and I ran into a friend who had the flu. He told me he had a cold, and we stood a good distance apart. I waved to him from a distance, greeted him, and after we finished eating, he specially came over to say goodbye. We were about half a meter apart, and he said 2 sentences to me. About 5 or 6 minutes later, I hadn't even ordered food for my child yet when I suddenly started having a runny nose, like a faucet that couldn't be turned off. I quickly covered my nose and thought to myself, I think I've caught it. That auntie I just met probably had the flu. In the afternoon, I played basketball with my son's friends, and some of the kids said, "No way, is she being dramatic?" I quickly covered my nose, but it was too late. I had to run out of there and didn't continue interacting with them. I used up 5 packs of tissues in just one afternoon, and my nose wouldn't stop running. It was truly unbelievable. The flu spread so fast. My heart and feet hurt, and in the hospital there are many patients with fever. Several severe flu patients are in the intensive care unit right now. Some of these patients have diabetes, chronic lung diseases, and are elderly, showing signs of respiratory failure, so we have to intubate them for rescue. There are also a few younger patients who have developed fulminant myocarditis, and they are currently being resuscitated.
Our medical staff is probably the most affected. Among more than 300 people, many have developed symptoms such as fever, sore throat, and joint pain. Those with milder symptoms are still working. Do doctors take precautions? When they're seeing patients or working in the ward, they wear just one mask. Recently, the flu has made a strong comeback in Shanghai. If you experience significant muscle soreness, high fever, fatigue, headache, or loss of appetite, you may have already been infected with the flu virus. The flu, particularly H1N1, has been very severe these past few days. Many people around me are suffering from fever, sore throats, and feeling unwell, including myself, with similar symptoms. Sisters, the flu spreads incredibly fast. This morning, I went to the hospital at 7 a.m. to take my dad for various checks. I had made an appointment at 6 a.m. But when I woke up, I could barely get out of bed. My limbs were sore, I felt chills, and it wasn't until later that I had a detailed blood test and was diagnosed with H1N1 flu. I want to share what I've been seeing. The number of flu cases has been extremely high recently, surpassing 1/3 of the population. This means that anyone you meet on the street could be carrying the virus. If one person in a household catches the flu, others will likely get infected too. Don't think it's just a cold. Sneezing and coughing won't just go away. Every time you cough, your lungs are being affected. This damage can lead to long-term cell destruction, which could turn into white lung. When white lung worsens, you won't be able to breathe. And if you can't breathe, how can you survive? Since October of last year, China's epidemic has entered another peak. The government sometimes calls it a flu virus, other times it changes the narrative, saying it's pneumonia, mycoplasma, or even claiming 99% of the cases are H1N1 flu. Experts believe that these phenomena suggest that the epidemic on the mainland could once again be out of control. Former U.S. Army Research Institute virus researcher Lin Xiaoxiu said, "I think the Chinese government is continuing to hide data and deceive the public about the public epidemic situation. To them, the lives of the people don't matter. What they care about is so-called social stability. If they emphasize that the epidemic is spreading, the people will worry about whether COVID will come back or whether there's a new wave of infections. They'll worry if the government will start locking down villages and cities again. Once they make such an announcement, the public will fear that the government will take extreme measures again." Lin Xiaoxiu further pointed out, the Chinese government strategy is basically to avoid revealing the actual situation, so when one wave of the epidemic peaks after another, they shift the blame to different pathogens. He added, "Don't have any illusions about the flu. Go to the hospital as soon as possible. My child caught the flu on the 11th while on a train. After a 2-day incubation period, symptoms exploded on the 13th. When we first found out, the temperature was 37.2 degrees Celsius. After taking some measures, the fever didn't subside much, but it wasn't too high either. At 4 a.m., the fever suddenly spiked to 39 degrees Celsius, and no matter what fever-reducing measures I took, nothing worked. Several of my friends caught it too, and they've been bedridden for several days. They said they didn't even have the strength to get up to go to the bathroom or take a shower,
and then they would just collapse back into bed, feeling completely drained. This flu has spread widely, with the CDC just releasing data that 99% of the cases are H1N1 flu. Have people around you been infected yet? We've already caught it. So what should we do? I checked online and found out how serious this flu is. I've seen many kids who couldn't get timely treatment, and their condition turned into white lung. Sadly, some children have even lost their lives due to myocarditis. It's truly heartbreaking. This is an indiscriminate attack. One person gets infected, and the whole family suffers.
Recently, the flu has been spreading like wildfire. More than one doctor has suggested that we should weld our masks to our faces. It's been said that you feel completely drained, with pain all over your body. Even the act of taking medicine is painful, and there's no appetite. You can only force yourself to eat a little, but the desire to eat just isn't there. In the face of overcrowded hospitals and increasing death tolls across China, on January 16th, the State Council's Joint Prevention and Control Mechanism issued a sudden notice requiring enhanced epidemic control measures before and after the 2025 Chinese New Year. The notice mentioned strengthening epidemic control at ports, travel, accommodation, and catering sectors, and also referred to the COVID-19 virus, requiring nucleic acid testing for COVID-19. In a rare move, the official Chinese news agency Xinhua reported it prominently on their homepage. As the 2025 Spring Festival approaches, flu cases, particularly H1N1, are surging in China. The spread of the flu has been rapid, overwhelming many hospitals, especially those treating severe cases. What's particularly concerning is that in addition to common flu symptoms, H1N1 has caused complications such as myocarditis and white lung, putting many lives at risk. Against this backdrop, as the epidemic worsens in China, international attention is also increasing. The United States, as a primary destination for Chinese tourists, should enhance health checks for visitors from China. As we know, China is the most populous country in the world, and during the Spring Festival, thousands of people travel abroad. Considering the speed and danger of H1N1 spread, the U.S. should increase temperature screenings and health checks for passengers arriving on flights from China to prevent the epidemic from spreading through international travel. It's not just about checking tourists. The government should also strengthen public education, promoting basic protective measures like wearing masks and maintaining social distancing to prevent further spread. We need to remain vigilant and adopt proactive measures to protect our own and others' health. At the same time, all epidemic control measures should be based on science, ensuring that accurate data and information circulate to avoid unnecessary panic. Hopefully, everyone can remain rational, pay attention to official information, and take precautions during the flu peak.